A customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
And we are back. We are here. I told you, starting in December, the 1st of December, we are going to Mondays and Thursdays from 6 to 7, so you'll have us during drive time. We had been getting so many emails about doing a show on men's health, urology, ED, and we were so lucky we got the best. The name of the clinic is Broward Urology Center, and we have one of the senior partners with us, Dr. Eric Shenven, and we're going to we're talking about a subject that my brother went through, and it's not an easy subject to talk about. But before we get started, hi, Eric.
Hi there.
Eric just got back from Israel.
Shalom.
Yeah, shalom. And how long were you there for?
Almost 2 weeks.
Wow. Did you go to the wall?
A couple times to the wall.
And you went to the Dead Sea?
Floated in the Dead Sea, hiked up Masada.
I'm so jealous.
It's
You've been there before, though.
2.5 years ago, I went with my family. This was just a men's trip.
Oh, okay.
And through
and
our
my
temple.
question was, did you hear the shellings going on? Because it's supposed to be pretty bad.
Thankfully, no. You have to be close to Gaza for that, and we were in Jerusalem most of the time, so nowhere near any of the activity.
Did you see the new, our new State Department there?
I may have driven by it, but we didn't go inside.
Okay. Food's good there?
Excellent.
Okay.
I've had enough hummus for a while.
Oh, I bet you have. So, for all the new people, tell us about your practice.
So our practice is named Broward Urology Center. I'm a urologist. I've been in Fort Lauderdale practicing urology in South Florida for about 16 and a half years now.
You're too young. You look so young.
Thank you. I appreciate that.
We tell it to all of our clients.
We are really practice the full breadth of urology. Two of us are fellowship trained in minimally invasive laparoscopic robotic surgery, myself and Dr. Gorbati. Dr. Yogel is our senior partner. Dr. Fowler is a retired emeritus partner, started the practice, and I've taken on a big bent at this point now to really try and develop a sexual wellness and a sexual dysfunction center that I think is being sort of trampled on in our field of urology, being the genitourinary specialist, especially for men, but also for women as well, where the gynecologist stops practicing, shall we say. And I think trying to really take that over again as the field is really exploding with the available diagnostic tools and treatments available.
And you're finding these new diagnostic ways because we've been talking about them. So today we're going to talk a lot about ED treatments. And gosh, I remember years ago you were like afraid to even say ED, but it's no big deal anymore. And it affects a lot of people, not just the older people. And we got a question yesterday that, because we tell people that you're going to be coming on, and they were concerned with high blood pressure. So I wanted to make sure that I got this on. So if someone has high blood pressure, do you have things that you can do to help them with their ED problem that won't cause their blood pressure to go up? I know the answer to this, but I'd rather hear it from you.
So the answer is yes. And as a specialist, I don't treat high blood pressure. The
Right.
primary care doctor, the cardiologist, the nephrologist, those are the ones that are going to treat the hypertension
But
in
isn't
medical
that some of the
terms.
causes of ED, though?
It's definitely associated with ED because it's associated with atherosclerosis or the clogged arteries. And if we think about the larger arteries in our heart, we can think about the much smaller arteries that supply the penis
So blood
and the
flow.
sexual organs. And in terms of blood flow, in terms of the nerves to those organs, and just in terms of clogged arteries, the smaller ones to the genital organs are going to clog off much sooner than the larger ones to the heart. And as far as people having hypertension, medications like Viagra and Cialis and similar ones were actually made. Viagra was studied as a blood pressure medicine to treat high blood pressure. It just really kind
Wow.
of stunk and didn't do a good job at treating the high blood pressure, but it had an interesting side effect.
Okay.
And that was improving men's erections.
Okay. So there's a lot of different therapies that you provide.
Absolutely.
So if someone has high blood pressure, there's something you can do for them. But the other question, guys, can you just about do something for anyone? Now, there's no such thing as 100%. But with all the technology you have, can you just about, it's not a cure, but help anybody?
Absolutely. I think from the simplest pill,
They want to know. They come see you that there's hope.
I think there's definite hope, and that is laid out in a guide I developed that's available through our Facebook site. And I think there's just a lot of people, even urologists, primary care doctors, that unfortunately have told some of the patients, not all of them, there are a lot of excellent doctors out there, but some have told their patients, look, the Viagra didn't work, or you're just getting older. You just have to throw in the towel. Maybe your relationship's falling apart. Maybe it's on the verge of divorce even, or whatnot, or someone out of a relationship had a now widower and so on, looking for a new partner, and really is just completely afraid to get in because that intimate factor is where they're troubled right now and just afraid to get into a relationship again. So whether it's a pill, whether it's a pump, whether it's a needle injection, these are things to try and help the system along. And then there are the newer regenerative treatments that we've been talking about the last couple of shows. The platelet-rich plasma, the P-shot injection, O-shot injection for women, and shockwave therapy. And those can treat the erectile dysfunction in that they can potentially cure it. But
Cure it.
certainly cure it, yes. Repair the tissue and bring it back to a pre-damaged state.
Does it matter what age you are?
Not at all.
Okay.
But certainly there may be some other coinciding factors, low testosterone and diabetes and other weight gain and lack of exercise and other things, nutrition that we really need to look at as well and get the whole patient in order, not just that one small area.
So we had another question that came in, then we're going to get to the meat of the show, asking about all these testosterone pills and things that are on the market. Do those work?
So there is no testosterone pill per se that's direct testosterone. It was available
Is
years
that
and
an
years
injection?
ago they found that caused liver cancer,
Oh, that's
unfortunately. So that was obviously taken off the market. There are needle injections, gels to rub on, pellet implants that we do, and there are a couple of newer ones that go in the nose and so
on. What
on.
do you feel? Because I've heard the pellets. Are those good?
The pellets are excellent. I think for me personally, I'm not one to jump right into the pellets because it's going to be a long-term treatment that's going to last 3 to 6 months, and I'm going to need a little more data in my mind. If I'm going to put something in a patient that's going to last that long, I want to know I'm at the right level. So I will use gels, injections, some of those other treatments, and find the right dosage for that patient. And that's how I use that to plan how many pellets I'm going to implant in a patient.
Okay. So we want to talk about platelet-rich plasma. Tell me how that works on a and that just for males only?
It's for men and women.
Okay.
So the platelet-rich plasma is the P-shot for men, the O-shot for women. And what it's doing is the platelets, we've learned, are really that most active cell in the body in the whole healing response. We're used to the platelet response acting in a case of trauma. For example, if you cut your hand on the corner of a cabinet or whatnot, you might not even notice you cut it. Certainly, you might get home the end of the day and see some dried blood and realize you didn't bleed out.
Yeah, I've heard that.
And look at a week later and it's healed up. You didn't ask the body to do it. So when that happens, the platelets come in, they plug those little blood vessels, and the clotting factors come in, help the bleeding stop. But we've learned the platelets actually release a lot of growth factors, signaling proteins that stimulate other cells to come in, stimulate stem cell production so that the damaged tissue can get chewed up and removed and replaced with new tissue, even new blood vessels. So when we do a P shot in a man and inject their own platelets that we've isolated from their blood draw in the office and inject that back into the penis, you're actually forcing the body's healing cascade to kick in. Whereas a lot of times, most times with ED, it's a very slow process. And the way I kind of describe it is it's gone on and kind of flown under the body's radar watch system and kind of snuck in because it's a very slow process. The body doesn't sense that trauma as if you got a cut.
So this process is faster. But when do you introduce it? If you want to start off, you said you start off with smaller things first. When would you introduce this? If nothing else is working?
Well, I think it can be used in two aspects. I don't necessarily foresee overusing it, but I think in any man that's having ED, any woman that's having sexual dysfunction and some mild urinary dysfunction, overactive bladder, even incontinence, then I think it can be beneficial. It doesn't have to be. If they're happy using a small dose of a pill and that gets them there, but if they want to get back to more of the way they were prior to having that problem, the spontaneity, a little more surety that they're going to have the erection and not have a problem, then that's where the platelet-rich plasma and the shockwave therapy can come in. So that said, there are still going to be men that fail the medicines, fail the injections and other treatments, and this is sort of another way of trying to rescue them and see if we can repair
I didn't realize
things.
there were so many tools that you have that you can use. What is, if you start someone off with the pill, is Viagra and I don't know what the other ones are those still your first choice?
I think they're definitely the first choice, at least as a test. If not as a treatment, as a test, to see that if they take either a lower or even a higher dose of the medication, if things go back to working normally or close to normally and so on. Then from there, it also gives us a look to the future. If they did decide they wanted to try one of these regenerative treatments, then we have a better sense of how well those are going to work.
What is, I know you've also have, what is that, probably the last thing available is the surgery, right?
An implant, a surgical implant.
Do you do those very often?
Not that often.
So you kind of come to what works before it gets to that stage.
Yes. I think that what I generally tell men is that if they were to need it, the surgical implant, usually which is a pump, it comes as sort of a malleable type of device, almost like a pipe cleaner that has less problems but is less discreet because it never actually shrinks in size. And the inflatable one that has a reservoir that brings water from a little bulb deeper in the body that we place in there and then fills the channels, and then you can release that water and have the pump deflate. I think that for men that need it, they can be very happy and their partner can be very happy. But what I like to tell patients is that if I can get your own body working back to the way it used to, why would we put something else in there?
And it's so much, I tell you what, I would feel so much more comfortable, you as a doctor, you as a urologist, helping me if I had that situation. I mean, some of these clinics out there, I think it's like maybe a general doctor, or I saw a thing now where you can actually call long distance and the doctor will write you a prescription. It's gotten crazy out here. And who knows if they're really a doctor. We're going to go to break and first of all, give everybody your phone number.
Our office number is 954-463-6408, and that's Broward Urology Center. You can get the number on our website, on our Facebook
Give
page.
me your website address.
It's browardurologycenter.com.
When we come back, we are going to talk about Peyronie's. My brother had that. And I don't know if a lot of men know about that or not. When we come back, we're going to talk about it. We'll be right back.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
And we are back. We're here with Dr. Eric Shevin. He is one of the partners in the Broward Urology Center. And not only do they practice urology, but Dr. Shevin is also, it sounds like you've kind of taken this on yourself with the practice, with the ED. Is that true?
We all do it, but I've really taken the reins on kind of developing this sexual wellness and dysfunction center. And I think when I read more about the data, some data that came out on the platelet-rich plasma and the shockwave, and caught my eye and started doing a little more training and research in that for myself.
You ever think about you've probably saved a lot of marriages?
I'd like to hope so.
Yeah. And you do a lot of good. But so my brother, about 10 years ago, said that he went to, I'm going to be careful about this, he went to a urologist, and I didn't know he had a problem, and the urologist told him he had Peyronie's. I had no idea what he was talking about. And I said, what is that? And he said it's the curvature of the shaft. And you said, hey, you wanted to talk about it. And I didn't really want to get into it with him. But this is something that's fairly common.
Well, it's not extremely common. I was doing a little research to get some statistics and whatnot. They talk about 0.5% of men. Again, when you look at men in their, I'd say 30 to 60-year-old range, then you can see 10% in those men. So all comers, the number is going to be a little lower. But it's a problem that can occur in conjunction along with erectile dysfunction, ED. It can be a problem that occurs just outwardly by itself, where there's not. Yeah, I like to think of it as a form, a subsection of ED, but a man may still be able to achieve an erection, but if the curvature, which can be in any which direction, up, down, right, or left, and most men have a little normal curvature to the penis because of the urethra and the way we're built, but some men can have, certainly right or left is not a usual curvature, up or down maybe, and usually up. The curvature can cause stretching with the erection and during intercourse, which can certainly result in pain. And it can result in pain for the man, and it can also result in pain sometimes for their partner. And what happens is, we think, is that trauma, usually during sexual intercourse, some type of trauma occurs, and there's a little bit of bleeding in the tissue. It doesn't have to be to the point of the extent of a real severe break in the tissue, which we call penile fracture. It's a tissue fracture, and that is someone who's going to come.
Penile fracture.
There is. It's just like fracturing tissue with your head smashing on the dashboard in a car accident. We call that a tissue fracture, where the pressure snaps the tissue open. In this case, the bend can cause the tissue to snap. That requires surgical repair relatively immediately, within 24 to 48 hours.
Is that something you x-ray to see?
MRI is actually a great test for it, but that's going to be someone in the emergency room, and they're going to know it. They may hear a pop. They're going to have pain. They're going to have black and blue bleeding and swelling into the tissue. They're going to know. This tends to be more just some very minor trauma, but we think that the bleeding into the tissue ends up, what happens with blood, when you get blood in tissue, if it doesn't totally absorb, it can start to form more collagen along with the blood and get fibrosis, which is essentially lay terms scarring. And that scarring then contracts.
Is there bleeding too?
It's not bleeding as you might say when you get a cut. It's inside. It's under the skin, in the tissue. But when that bleeding in the body, the thick tissue in the outer lining of the penis of the channels that hold the blood, when that gets scarred up, it can contract and bend in a certain direction. And so the patients tend to have a plaque that scars a plaque. And men will feel that as a lump or a different number of lumps in the penis. It's not always painful. So for some men, it's conscientious, don't like to have the curvature. Certainly if they're not in a married, committed relationship and they're worried what someone's going to think, that's on their minds. But it also can affect if it's as significant enough of a bend. Some of these are 10 or 15 degrees. But I saw a man today, 45 degrees.
Wow.
And there are pictures of even like 90-degree bends where you can imagine it's very difficult to have intercourse.
So what do you do? I mean, the guy who came in with 45% curvature, what do you do for them?
So when there's a plaque, when there's not a plaque, it's a lot more difficult to treat. There are some surgeries that we can do to try and release the tissue and straighten the penis up again. When there's a plaque, we can treat that with, well, let me preface that by saying the treatments have been terrible in the past. What we learn in residency are high-dose vitamin E, a medicine or supplement called Potaba, which I won't get into exactly what it is. It's too hard to explain. But that was 6 times a day to take 6 pills.
Wow.
Crazy.
Which one's worse?
The different topical gels and other medications that have been tried over and over and over. There are even some stretching devices, which do have some merit. Almost think of it like the old medieval rack to really try and stretch the tissue out.
I can see all the men out there now pulling over their cars.
There's some data on it, so it definitely has a place and value. But probably about 3-4 years ago, a medication called Xiaflex, that's the brand name, XIAFLEX. This is a medication that is an enzyme that can break down the plaque. Can, not always does. And it does have some risks where you can, if you understand, trying to inject a thick, hard, scarred up plaque is trying to put a needle into stone.
Oh, okay.
So it's not so easy to do, and you can rupture the plaque. It's not that common, but there's definitely some problems. And Shockwave and P-Shot has come into the scene and has really blown my mind as to how well. We generally tell these patients 3 months for improvement. I've watched plaques disappear in the 3-week course of treatment that we've treated men. I tend to lean on the Shockwave by itself for just the Peyronie's. When there's ED, I might add the P-Shot to it, but we can treat both at the same time.
Amazing. So tell everybody again, how can they reach you? How can they make an appointment with you tomorrow morning if you're having difficulties? And we're not just talking about the curvature, but just maybe if you're having problems and you want, listen, if there's a way to help you, your clinic definitely will. Broward Clinic, Urology Clinic. Give everybody your phone number.
So it's Broward Urology Center, and it's 954-463-6408. Just
now,
give us a call.
Do they ask for you, Eric?
They can ask for me. There's 3 of us there, so Depends how imperative and urgent the appointment is. One of us can see you.
And Dr. Eric will be back again with us next month. If you have questions, email them to me. And I'm so glad you're part of the show. So you'll be back next month. We'll be in the 6 to 7 hour next month on Mondays and Thursdays. Take care.
Look forward to it.
Thanks for